Good morning, everyone, and welcome to this conversation on climate change and children's health. I'm delighted that you could join us. I'm Joe Waters, the co-founder and CEO of Capita. Capita is committed to exploring how climate change is impacting our youngest children and their families, mobilizing parents to be the most effective advocates on behalf of their children in an era of climate change. And we are also working to create new policy solutions and strategies for programs and government at all levels to help children and families and the systems that serve them adapt in this era of climate change. So this is a very timely conversation, one we're incredibly enthusiastic about here in the context of COP going on right now in Sharm el-Sheikh, Egypt, in which really in some ways for the first time, early childhood development, resilience, and of course, real conversations about loss and damage are happening. So delighted that you could join us. I'm now going to turn things over to Lola Adedokin of the Aspen Global Innovators Group and Frederica Perera from Columbia University School of Public Health.
Good morning, everyone, and thank you, Joe, for both this timely conversation and for the opportunity to meet a fellow alumna of Mailman School of Public Health and incredible author Frederica Perera. Pleasure to meet you here in this time in this moment on this important topic. I wanted to, please.
It's a pleasure to meet you, Lola.
Just wanted to note as we launch into this conversation, a little bit of grounding. I'm a Pan-Africanist in the world, and as I look around and sort of in this sort of moment as we move beyond the pandemic and start to really focus back on critical issues around climate change, the fact that those who are most affected are in places that have uh, um, been the least involved in influencing and contributing to some of the climate impacts. In fact, what your focus, especially on children, the youngest children, is so important right now as they rarely get the spotlight on the conversation, and yet they're the ones who will be living the longest with these impacts. So, can you just tell us a little bit about how you shape the problem for us? Name the key issues.
Sure, I'd be happy to do that. And in the background, whoops, you see the book that has recently been published by Oxford University Press on this topic, children's health and the perils of climate change. And in that book, I really I laid out the many reasons why children should be at the very center of our thinking on how to grapple with climate change and co-pollution, also from fossil fuel, air pollution that is affecting their health in very serious ways. And in fact, I wrote that book because I wanted to have it as a wake-up call and a call to action for parents and grandparents and pediatricians and other health providers, as well as government leaders, to see the full accounting of harm to children from these two sort of twin threats from fossil fuel emissions. And I also wanted them to have hope and to see the tremendous opportunity that we have using solutions now available. This is not going to require a moonshot, but we have the solutions available now to provide a healthy and equitable future for them. And as a result, to become actors and agents for children. And I can now just briefly tell you what the health impacts are. And I will try not to be too depressing, but then we'll come to the solutions and the opportunity, which I think will lift our spirits. So today, because of climate change, all children are at risk. We know that, and they're at risk of heat-related illness, and we're seeing that often fatal. Physical and psychological trauma that is scarring them as a result of severe storms and floods due to climate change, the more severe floods and storms, asthma attacks from breathing forest fire smoke, more climate-related infectious diseases, dengue, malaria, and in this country, we've seen a spread of Lyme disease, and children are most affected. And then we're seeing these widespread droughts across Africa and even in our country and really across much of the world this last summer. And in the past, causing malnutrition and stunting. And stunting is occurring not only in the bodies, but in the brains of these young people. And last, as a matter of fact, in 2020, drought was a cause of growth stunting of 150 million young children globally. But then I also lay out the many harms of air pollution, and they come also from burning coal and oil and gas and diesel, gasoline. Air pollution is not only a well-known and notorious trigger of asthma in children who have the disease, but we now know that it is an initial cause, a contributor, not the only cause, but a major one of asthma in children. And of course, we know the staggering statistic about infant deaths. There are 500,000 every year due to air pollution. Preterm birth and reduced cognition, attention problems, ADHD, and even autism have been linked, including in our studies at the Columbia Center for Children's Environmental Health, to air pollution. And we're now discovering anxiety and depression, other mental health problems in children and adolescents. And these health effects have immediate impacts, but they also can persist and affect health and functioning over that child's entire lifetime. And we are especially concerned about the mental health problems, which are rising in the young. It's now a prevalence rate of 15%. And both climate change and air pollution are contributing. And even when children and the young are not directly exposed to disasters causing evacuation, for example, and mental health issues following those disasters, just the awareness of climate change, what we're talking now about climate awareness, is affecting many, many children. And in a recent survey of 10 countries, almost 50% said that concern and worry about climate change was affecting their daily lives. And that places them more at risk of mental health disorders.
Thank you for that. That's incredibly sobering. And yet, in your book, you, as you know, names real solutions. So in light of that, the dire state of affairs at the moment, can we now turn to some real solutions? So aside from accelerating the transition from a fossil fuel-based economy, what investments in children's health would result in the most significant return if scaled globally? What are like the top 5 solutions that you can lay out that were presented in your book?
Mm-hmm. Such a good question. So we need to think about a holistic and equitable approach that centers on the particular vulnerabilities of children. And if you would like later to come back to why children are so vulnerable, and then who among all the children in the world are most vulnerable and in need of protection, we should do that. But certainly we need to think about protecting young children, even starting in utero. And that does require a multi-level, multifaceted approach. And again, we have the tools at hand. In fact, I wrote the book in large part because so many of us have been just paralyzed by the magnitude of the problem and the thought that, well, there's not much we can do to help. It's just beyond our control. But in fact, we know how to mitigate or curb climate change, rapidly transitioning to cleaner energy and energy efficiency, and really importantly, boosting natural carbon sequestration storage by soils and forests, for example, and moving agriculture to renewable and conservation approaches. And a lot of this is happening now because the economic benefits are becoming so apparent. We're seeing more and more these trillion-dollar costs from major storms and catastrophes. And a recent analysis told us that once we get onto a low-carbon sustainable growth path, then this is what will be wonderful for children and their future and their children's future. By 2020, we will actually drive benefits in terms of climate, public health, economy, and jobs that have a direct economic benefit, I should say, of $26 trillion and create over 65 million new jobs by 2020, compared with just going along as business as usual. So, and that's starting to shift because, the thinking of governments and businesses is shifting out of, in part, self-interest. And we mentioned the economy, but also, of course, this world security. So getting to your question of, aside from accelerating this transition, which is primary for mitigation, what would have the greatest benefits? I don't know if I've scored them and ranked them properly, and we can talk about that. But first of all, government, communities, and all of us need to work together to increase the resilience of children, provide clean water in drought-prone areas, early warning systems for flooding and heat and air pollution. And that's happening in some parts of India and other countries. Disaster response training and evacuation planning, in which children are engaged and empowered and actually can teach their elders on what they know and how to react. Also, we need to think about shaded areas near schools and homes, green and cool roofs, and mosquito nets, of course, to protect children from malaria and dengue. But to protect the most vulnerable children, reduce disparities. Really, we need the broad social programs to reduce poverty, provide water, sanitation, hygiene, basic, what are called WASH services, high quality healthcare, that's critical. And I'd love to talk a moment about how healthcare providers, pediatricians, physicians can help. Provide quality healthcare and also quality education, and particularly to girls and young women who so often have been excluded. And then, as Capita has said, we need global financial institutions to step up and invest in early child development. And front and center at COP27, of course, wealthy countries need to honor their commitments to provide financial support to those countries that have borne the brunt of climate change.
Thank you for that. And in your voice, I also hear and see the opportunity and the fact that, there is a call to arms and there's a real response protocol for us to react to. But one question for you: I'm a public health professional in the space, and I also have a background in philanthropy. And I can tell you right now, we need guidance. How do we engage? There are lots of areas in which we are being called to respond to. But can you give us a little bit of advice on what can physicians and public health professionals do to increase resilience, and how can they help to advocate and center children in the conversation and in the solution?
Absolutely. Physicians, healthcare providers are trusted voices. And, we know a lot. And I just think we have to be better at communicating, which is why I wrote the book. And I've tried to get better at doing that. But health professionals can become the greatest advocates for children, and they have begun to do so. As you know, the editors of medical journals, for example, have gotten together and published about how this is the most urgent crisis facing public health today, and action is needed. That was something like 20 plus journals. But what physicians and healthcare providers can do in their work, it can be very, very important. They can counsel children and families on risk reduction strategies. And they can identify children at particular risk from climate impacts or air pollution on the basis of their underlying illness. Say the child already has asthma. They can identify the child at risk of any episodes that would trigger more asthma attacks. Geographic location, on the basis of geographic location, they can counsel patients and their families. Proximity to air pollution sources, whether they live in urban heat islands, or floodplains, and to counsel them as to what they can do to protect themselves and what services are available. And then they can also counsel on the basis of mental health burdens, whether that child has experienced anxiety after being forced to relocate after a wildfire or a disaster. So there's a lot we can all do hands-on, but also as very, very powerful voices. And I talk about that in the book. And then you asked, what more can philanthropy do?
Yes.
Well, I had the honor, and it was wonderful because I've been a researcher all of my professional life and have scrounged often for grants. Spent my life writing grants to NIH, the NIEHS, other federal agencies. Even at one point, EPA was funding us, and hopefully will again. The Trump administration decided that we didn't need more research on children's environmental health. But anyway, grant writing is a large part, as you know, of researchers' lives. And I had the honor of being on a board that actually gave out money to different enterprises that were sort of not a lot of money, but that served as a catalyst for community work and for work on better agricultural practices and energy efficiency, things like that, but small amounts of money that served as a catalyst. And philanthropy has a unique role in funding some new ways to communicate. That was another thing that we tried to do, to communicate better the urgency of the problem and also empower people to take action. Bring in parents and grandparents and caregivers and also policymakers who are not so aware, but also to seed innovative projects that are high risk, couldn't get funded by big agencies normally. We had to always do that catch-22 thing, Lola, about that, where you have to show you can do it before you can get money to do it and do it properly. That. So when you're dealing with big agencies. So high risk, but also high potential seed money, and also steer investments toward historically disadvantaged and environmental justice communities. That is so key. So are you going to ask whether climate catastrophe is a foregone conclusion?
I am going to ask that.
Okay, because I can just picture everybody's faces getting long, but also I hope we've sparked some hope. Let's end on a note of which I really feel very strongly, that a note of hope. Certainly, red alert is the right term for where we're today. And the UN Intergovernmental Panel on Climate Change has told us that we need to act urgently to limit global warming to 1.5 degrees centigrade below pre-industrial levels. Above pre-industrial levels, no higher than 1.5. And we're now on track to reach this threshold in the next 2 decades and have an increase of as much as between 2 and 3 degrees centigrade. Now that would be very, very serious, but they believe, and we believe, and experts are saying, we can change this trajectory, and with solutions now available. But there is absolutely no time to waste. And according to the UN, we do have a window, but that window is rapidly closing. So we just need to continue to do our very best to sound the alarm and also motivate people to become involved and take action.
I hear that. And one last question for you is, where do we go first? We've talked about disproportionality and how children are disproportionately affected. We've touched on issues of equity and access. Can you just give us a little guidance? I mean, where can we get the best bang for our buck in investing in early children?
Yeah, investment in early childhood is so critical. And we need to start with those children who need it most, because in doing that, we will help everyone.
Yeah.
and we will benefit all children. Um, and I actually was in a conversation with a team I'm working with on air pollution and different climate policies and health benefits of those policies in different cities. And we were talking about how there's evidence that if you target your policies to benefit those communities that have been hardest hit, communities of, and this is in the United States, communities of color, low income, you actually you achieve the greatest public health benefits overall. And we do need, out of equity and a moral compass, we do need to help these children the most. And we see that they are the ones who are most harmed are those who are having disproportionately greater exposure to air pollution because of siting of polluting sources, because of where they live, that they may live in areas most at risk of heat waves and severe weather events and flooding and drought. And then these impacts are always compounded by a lack of adequate nutrition and healthcare, education, and social support. So we need to aim our strategies to help those people who are hurt first and worst. So that would be, and I also want to argue for not separating. I'm one for taking things out of silos. As you could see, I treat fossil fuel as holistically with air pollution and climate change and how they are jointly affecting health and children's future. But I also want us to think about not adaptation in one silo and mitigation in another. Both are needed and urgently needed, and they can intertwine. They're intertwined, and the social support programs essential for both are there. I mean, need to be there. And so there are really new ways of thinking about how we address the crisis and do it in a smart and strategic way.
I appreciate the commitment to taking a holistic approach as a public health professional. Again, that is the entree to really engaging multiple parties, multiple sectors, and multiple actors. And so I really appreciate that emphasis. And I'll just close with I learned a lot from your work, Children's Health and the Peril of Climate Change, and I appreciate the fact that you brought both the academic lens and the solutions orientation to the conversation. As we are in the negotiations at COP27, other leaders are there having the deep conversations right now. Can you give us a final message? What message do you have to share with those who are in the field, on the ground, making those critical decisions as they go through this week?
Well, as they go through this week, and I have colleagues and friends who are there now participating, they need to put children front and center. And unfortunately, this has not been the case. I know that looming over them are the huge, economic impacts and the issue of how to support the countries that are hardest hit, how rich countries must honor their agreement to help. But they're thinking about, they're not really focusing on the public health and the health of children and their future specifically. And I think that's really a big omission. And if they were to do that, I think that would galvanize them in new ways. Because look, after all, we're all in some way related to children. We may have children of our own and grandchildren or nieces, nephews, children we care about. And if there's any moral value that is shared across all cultures everywhere, it is the concern for children and the value of protecting children. So I'd love to have those leaders stop while they're looking at all the numbers and negotiating and all the gatherings, head to head, chattering away, that they really stop and think a bit about what their decisions are going to mean for children now and in the future.
That's the right message. To begin with the end in mind, and the end is that we need to think about children first and their future. So I really appreciate that. Dr. Perera, thank you for your leadership. Thank you for your commitment to pushing not only the conversation forward, but for presenting solutions that all actors can deliver on if they have the right orientation, which is centering children in this conversation and in the solutions building. We really appreciate that, and I really look forward to sort of hearing what comes out of the negotiations, watching how folks apply your solutions and those of other colleagues in the field as we move forward and look to the next several decades of what I anticipate will be successful, us achieving that high level goal. So thank you for that, and like to now turn to Joe Waters from Capita to close us out.
Well, thank you both for such a thoughtful conversation, timely conversation. Certainly, we share with you that North Star, and I would encourage everyone to buy this book. This is an excellent book, and as is indicated by this conversation, certainly solutions focused, solutions oriented, but of course grounded deeply in the research. Thank you, Dr. Perera. Thank you, Lola, for this time today. And thanks everybody for joining us. Have a great rest of your day. Bye-bye.
Thanks all.
Thank you.